Well, hi everybody. I want to welcome you to a video chat on tele-assessment, which is what we've sort of, I don't know, maybe we've made up that phrase, probably not, but is really our attempt to get a conversation going about doing assessments virtually through video conferencing. So today I'm super happy to have 5 people from Virginia joining me, different practitioners, different leaders. I'm going to have them introduce themselves in a second, but we're just coming together to have a conversation about what's working around tele-assessment, what you guys have tried, maybe what wasn't working and you found something that did. So we're just going to kind of go through this today, and we hope that the discussion is just a way to offer others some support when everybody's trying to figure this out at the same time. So my name is Dana Childress. I work on the professional development team here in Virginia. I'm one of the professional development consultants, and I'm going to be playing your host today. That's sort of a funny thing to say. So let me go ahead and have the folks joining me introduce themselves. Lauren, do you mind going first?
Sure. Hi, I'm Lauren Bernhard. I'm a speech pathologist, and I work with the infant-toddler connection of Fairfax-Falls Church.
Thank you, Lauren. How about you, Jen?
Hi, I'm Jen Saddington. I'm a physical therapist, and I work for the infant-toddler connection at Fairfax and Falls Church also.
Thank you. And Lauren and Jen are on the same team, which adds a nice perspective because they're doing this all the time. Maria, can you go next?
Sure. My name is Maria Grady. I'm a physical therapist. I also do a dual role as a service coordinator for the infant-toddler connection of Loudoun.
Great. Thank you, Maria. So you've got both hats on, being the service coordinator and PT too. Good. Thank you. Jenny?
Hi, I'm Ginny Heuple. I'm the program manager and a physical therapist with the ITC of Prince William.
Thank you, Ginny. So Ginny's wearing multiple hats as well. How about you, Sandy?
I'm with the infant-toddler connection in Norfolk. I'm the local system manager, but I also serve as an educator or a service coordinator on our assessment team.
I was thinking that you have like 3 hats. Yours is pretty tall, right? Managing all that. So thank you guys for doing your quick introductions. So where I wanted to start today was kind of at the beginning and thinking about what kind of things you do to prepare the family before the tele-assessment. And we can also talk about how you prepare as a team, because I think they're both really important. And the better preparation we do, it makes sense to me that the tele-assessment is going to go more smoothly. Also, you know, knowing this is a new uncharted territory for the families and for many of the teams. So I'm just kind of curious, let's start with families. What kind of things are you guys doing to help families get ready for the tele-assessment that's brand new? So I'm just going to throw it out to one person and then we'll bounce back and forth. We'll bounce around with our ideas. So I don't know, Sandy, if I can pick on you first. What kind of things are you guys doing in Norfolk to get families ready?
Well, of course, the first thing we have to do is determine if they have the technology to do it and if they're going to consent, and then what platform will work. Because right now we're using WhatsApp and FaceTime. The FaceTime's only if you have an iPhone, so we have to figure that out first and get them up on WhatsApp if they don't. And then we actually send them an email or we talk with them over the phone about what they need to gather. And so we're asking them to gather, you know, a favorite toy of the child. And then depending on the age, so we have a list for toddlers and a list for infants. We're looking at things like, you know, paper and pen or crayons, puzzles, books, blocks of any kind. So some of the things that we would normally use in an assessment, or rattles for a younger child. And then we also talk to them about the best way to set up the environment. And I saw in another webinar that people talked about putting out a mat or a blanket. And if the camera can see that mat or blanket, then everybody knows the child's in view of the team. And so we've used that as well to kind of say, okay, if he's sitting there, then we know we can see that child. So that's how we've been prepping families.
Okay, I love that mat idea. That kind of gives like a very concrete way for the family even to be thinking about that. How about you, Lauren? That sounds a little similar to what you guys were doing. I know with the list, you had a list of some toys and things for families that, you know, if they have access to those, can be handy.
Yeah, so in our system, our service coordinators are making the first contact with families when they are referred and are sort of sharing the same information, like Sandy mentioned about, you know, consent and technology. We're using the Microsoft Teams platform for the majority of our visits. We do have a secondary platform available if that's not working, but Teams is our preferred. And the service coordinators are helping the families to get through that initial contact, that initial visit. We're providing them with documents if they, sort of like emailed documents if they need help troubleshooting. We've worked through a variety of documents with pictures and resources for the families if they can't figure out how to connect. But as they're preparing for ASP, the service coordinator is reaching back out to them, sharing a few of those things, asking them to, maybe have a few, like you mentioned, favorite toys handy. A lot of our families don't have handy or readily available all of the items that we might like to, to have if we're, completing something like an ELAP or an ASQ. So we've actually found that we've gotten really, really good information from our families by watching them use what the child actually has, the child's preferred toys, and sort of being able to interpret from there. But we are, trying to set ourselves up for success by helping them prep ahead of time.
Perfect. Good. Yeah, we're going to talk about that functional piece and that good observation in a second, because you're right. That's so important. Regardless of what the family has, you still want to see what the child can do and what's hard, those kind of things. So Maria, I know Lauren mentioned the service coordination piece. Does that sound pretty familiar, pretty similar to how you prepare families from the service coordination perspective, or?
We've done a little bit of both, because
Okay.
now our intake team is the first wave of people that go out and contact the family and get them prepared. And so I do follow up with an email as well, or a phone call to make sure that, we are setting them up, to understand what's going to happen. And I also offer to do a trial run with them prior to that evaluation, just to see if the technology is going to work and to put them at ease. So I've reached out to some families, and I've noticed that when I've not done that and set up the environment and the assessment, it just didn't go as smoothly as when I have prepared the families a little bit about getting their favorite things. And then I've also tried to put them at ease and say that if they need a break, or if their child is close to nap time or hungry, feel free to let us know to take that break and let us see what's going on as they're feeding them or giving them a snack or needing to change their diaper. All of that, makes them feel that, they're at ease.
I think that's a great idea. So you're kind of giving them permission that it's okay for them to do whatever they need to do. And it's actually really beneficial to the team to be able to watch some of that. I love your idea too about the technology check ahead of time. So that sort of extra meeting just to make sure things are good. I've heard people saying there are things like even positioning the camera, like Sandi was saying, you can kind of troubleshoot some of that before you have everybody joining. Ginny, I'm wondering, is anything similar to that or a little different in your program with how you prepare families?
Very similar to what everybody else is saying. We, some of our service coordinators have told me that they've been doing kind of practice runs with the family the night before or the day before, just to make sure, especially if the family's a little nervous about technology, like some of us are.
Right.
We also have what we call a telehealth prep checklist that I developed based on some things I'd seen floating around, because a lot of us were sharing information, as I'm sure everybody knows, prior to really getting into the thick of this. So I developed a telehealth prep checklist that has some things for everybody to consider, some things for the family to consider, and then some things for the professionals to consider. And then just a brief, 3 bullets of how to wrap up, to review it, see if everybody felt good about the session, just kind of debrief a bit. How could we do better next time? What was helpful to you? Just so, because this is so new to us, we want to know how telehealth is working for families. And we've had amazing feedback. So we've been very happy.
Well, good. Ginny, after this call, I'm going to be emailing you like, can I see your checklist? Because that's the kind of stuff we want to share. That's a great idea. I know Maria sent me something like that too, that she developed for herself. That was just like a written document, what I need to make sure I remember when I'm doing this. So those are great strategies when it's all new, just like you said. Let me touch base with Jen and see, did you have any other thoughts, Jen? Anything sound kind of familiar or something else you'd like to add?
Yeah, I work with Lauren, but one of the things that we've really found that has been helpful for some of our families who have been more hesitant about their tele-assessments is really reassuring them that we don't need their child to be sitting in front of the TV, in front of the computer or in front of the phone, and that really, even seeing just the family walk around and follow them with their iPhone or their tablet is really beneficial for us. And I think that kind of feedback to families has increased the participation in our tele-assessments, because they're not so worried that, their child's not going to perform on camera, or that their child is a really kind of busy, active child, that they weren't sure that this platform was going to work for them. But we've had really successful visits and then really good feedback from the families that they're interested in then pursuing the telehealth kind of therapy.
Good. So you're kind of making that connection, building up to what you'll need for the therapy. You know I think about if I had to get my son's 16 now, but if I had to get him at 2 to try, if I was thinking I had to get him in front of a camera for an hour so somebody could see it, that would be super stressful. So I love laying that groundwork. That's not what this is about. He does, the child doesn't have to be right there. And a friend of mine said, she was on assessment, and the mother was like, I need to go change his diaper. And she said, well, can you take us with you? So the mom picked up the phone, took them with them to the diaper changing table. And she's like, we got to see all kinds of cool stuff about how they interact, that, fortunately that mom was comfortable taking the team with her. That's a big part of it. But, that comfort that this can be, we want this to be, it's a formal event, but as informal an interaction and a great observation as possible. So that's really super helpful. I love thinking about how we prep the families. Let's think about, how do you prep the team? Like, how do teams touch base maybe beforehand, or any ideas you guys have for helping the team be prepared when they come together virtually, since they're not able to prepare in person. So maybe I'll ask Ginny, if you don't mind going first this time. I don't know if there's anything you guys are doing differently or maybe similar before to get your team ready.
Mm-hmm. Pretty similar to face-to-face. The team meets beforehand, and we do that on Zoom as well. That Zoom is the platform that we're using. So we meet, the service coordinators are collecting information. We have electronic forms, I guess maybe I should start there, that we've had for years. One of our people is a tech whiz and developed some PDF forms. So we've had fillable forms, and our service coordinators collect information at the initial visit in the 3 areas, the child indicator areas. So it's already set up how it's going to be put into the IFSP. So she emails that to the providers that will be on the assessment team. We review it. We have a briefing prior to the parent logging on to the Zoom session that day, and then we start. So it's the same thing. We're reviewing electronic documents like we always have if we're fortunate enough to get maybe a hospital discharge, the notes from the intake specialists at our office, and then the service coordinator's initial visit notes. So it's very similar to what we've always done.
That's good. Similar is good right now, right? The fewer things have to be totally different is a good thing. I'm curious about, how do you guys decide who's going to do what on the team? So maybe Sandi, I'll throw this out to you. Is that changed at all since people aren't in person together, or does that, who plays what role on the team? Is that pre-decided, or is it kind of the same as it's always been?
It's very close to how we had it before, but we had to become more structured. So we have, of course, a service coordinator, an educator, and then a therapist on the team. And just from a logistical standpoint, what ended up happening is the educator always writes the narratives, and the therapist is filling out, we use the ELAP and the vision and the hearing and the MChat, and possibly the reel if it's needed. So the therapist fills out the protocols, the educator writes the narrative, and at the beginning, the service coordinator is leading the discussion of the routines, because we do a quasi-routines-based interview. And one thing that's a little different for us is we don't have that intake prior. We're combining our intake with our assessment, so everybody is hearing all that rich information at the same time. So as the service coordinator leads it, it becomes very structured. She'll ask a question in one area, and then she'll pause and she'll address each of the other team members and say, do you have any more questions? Do you have any more questions? And we stick with the area. So we've gotten very structured, so nobody's talking over each other, but we're getting all the information in related chunks as we go through the process.
Okay, so it sounds like you took the process you were using before, and you just had to be really intentional about how you're implementing it now.
Yes.
Okay, all right. Well, let me ask you, Maria. How do you prepare with your team? Do you reach out to them, and do you already know who the team members are going to be? Are they pretty consistent team members, or do you have to touch base with your team members, beforehand to get everybody on the same page?
We all do try to get in touch with one another prior to the assessment. And it's usually the service coordinator who takes that role. We all have dual blended roles. So One of us, there's always a two-member team. and whoever's the service coordinator will kind of make that evaluation flow a little bit. But we always discuss, or I always discuss with my teammates, whatever the area of concern is, that's the area, especially if it's for eligibility, that we'll address first. And then based on that, determine if they're eligible, and then move on to the ASP after getting their verbal consent. So that's how ours flow. And, depending on the area of concern is who takes that lead. We'll decide prior to that, what will happen. We also have the electronic files, so we do, we are able to share all that information ahead of time, and then we get an intake application back from the family as well. We send it out to them and hopefully get it back, and so we're able to prepare a little bit more about their area of concerns and build on that. So I usually start with that intake application, see if we have any concerns about that, and then move on from there.
Okay, yeah, I love the idea of collecting as much information as you can so everybody goes into the assessment prepared. I think that would make it easier on everybody too. Jen, how does that sound compared to what you guys do? I know you have the electronic system so folks can review things ahead of time.
Yeah, and Lauren, jump in if I miss anything in our process. But our service coordinators do the intake visit, and then we determine the majority of our eligibilities at desk between the intake visit and the scheduling of the ASP. And so our system is pretty similar to what a lot of you guys have described. We as therapists or interventionists meet with the service coordinator usually about 15 minutes prior to the assessment on our platform, kind of talk about any concerns, any things that service coordinator might want to share with us. And then typically our assessments run similar to the way that kind of we normally interact. We're pretty fortunate that we often have the same ASP partners. And so like Lauren and I know each other well and know kind of our normal division of how our ASPs go. And so we're able to kind of jump questions back and forth like we would do typically.
Okay, Lauren, would you like to add anything to that when you think about the prep part? I think it's great that you guys work together. It probably makes the preparation a little easier because you guys do this together all the time.
Yeah, Jen and I don't have to do a lot of discussion about, who's going to ask what questions, but to sort of reflect on what I think Maria was saying about how they structure the conversation. Eligibility is generally determined for the majority of our kids, although I will say that that's decreasing some now that all of our initial visits are being done via telepractice, that it's, we're needing to see more kids at ASP to determine eligibility. But the service coordinator often opens up the assessment by asking the parents for updates, which generally flows smoothly into a discussion of the concerns, because typically the parents will provide an update about the area of concern. Oh, she pulled to stand for the first time, since we saw you last week, Dorian, or, Lauren, she said 3 new words in the past week. And so it flows like that. But because we are so comfortable with each other, we just sort of jump back and forth, generally within one area of development, within the 3 areas, asking questions. Because we're on video, I can see if Jen is typing or taking notes. And so I might ask a follow-up question related to something like dressing, if she asked the initial dressing question, just to sort of keep things flowing and to help maybe the family stay on track if their 2-year-old has, taken a right turn off into the family room or something. But yeah, I think our flow is similar. Maybe it's taking us a little bit longer to get through the discussion portion with the family. But I think that's pretty normal given the current situation.
Yeah, I think so too. I think it sounds like you're kind of reading each other while you're also trying to read the family to help this flow. And that's pretty important too. So where you guys have helped me kind of segue into thinking about, we've got the team prepared, we've got the family prepared, just, hopefully feeling pretty good about this. Now we think of actually having the assessment, everybody's on camera. I'm curious about what maybe we could think about strategies you guys are using to gather the information you need. So you have your tool, you're using informed clinical opinion, you're using observation skills, but what's that look like for your team? Like, are there any tips maybe you have for people that are conducting these tele-assessments in terms of being able to get the information you need? Because there's been some stress about I'm not present with the child. I can't see if they dump the pegs out of the bottle, like that item on the ELAP. So, you know, I think we kind of have to lean more on observing the natural environment, like you mentioned, Lauren, and coaching the family through some activities. So I'm curious about what it's, you know, what strategies you're using to be able to get the information you need in order to prepare for writing a good IFSP. Let's see, I guess, Maria, do you mind if I start with you? Are there any strategies that you find helpful to help you get the information you need?
I think, you know, just watching and telling the family, you know, whatever they want to do at that moment. And like I said before, like the area of concern, you know, if they wanted to start there, like show me, you know, what, you know, how he moves, you know, as a physical therapist. That I think is one of the easiest parts, because we can see them move if they're moving at all, or position, you know, ask the family to position the camera or, you know, whatever device they're using to allow us to see a little bit more. So I also, you know, am comfortable asking the family, you know, if I need to see a little bit more about posture at their feet, you know, please, you know, would you mind taking off, you know, their pajamas or, you know, their shoes and socks, and to let me see what, you know, their concerns are at the time. And I can also assess if there's some tone issues, you know. I can have the family, you know, and I have a doll, and I'll, you know, kind of promote what position I need them to try to do with their child, and see if I can gather some information that way, you know. Yesterday I did evaluation, and I really wanted to see their, you know, head control, so I asked mom to pull them up to sit, and, you know, I was able to see so much in that manner. So just talking them through a lot of things, and then watching, you know, and I think my teammates and I are getting used to watching better. You know, I also have a hearing deficit, and so I have to wear the headphones over my hearing aids, or else I get a lot of feedback. And so I think I've worked long enough with my teammates to know, you know, they know when I miss what everyone's saying, and they will reiterate, you know, oh, you said this. So a lot of also, you know, repeating what the family has said to kind of reaffirm has helped me gather a lot more information than I would have.
I think there's tons of tips in there, Maria. I love the show me prompt. So prompting families to show you what this looks like. You talked about using your doll, and I've had a couple of people show me that they're using kind of a prop if they want to have the child positioned a certain way. The observation is so important, and even what you just said about repeating back what you've heard, it sounds like that helps you, but it's like you said, a great way to check in with the family. Did I hear you correctly by rephrasing that back? We've got a couple of PTs on today, so maybe I'll throw it to Ginny. How does that sound to you, Ginny? Any other ideas for how you get what you need?
No, I smiled when she said the doll, because any PT worth their salt has her little Raggedy Ann doll, or you know, some kind of doll. So we have to have a quiet place where we're not going to get traffic through. And so I'm doing my assessments in one of my bedrooms in the house, and I've got my doll in a drawer and everything ready. So I smiled when I heard that. But just exactly what she said, just watching, talking, exploring the routines, and then asking for things that you're not seeing that you want to see. So I had to ask one of mine, who the child actually had some significant motor delays. And I have to say, I went into it worried. I was wondering, am I going to see what I need to see? Is this going to be good enough? It was really easy. You know, they went through the routines. They placed him on the floor on his tummy. And then I didn't even have to ask. They got him up to sit for a while. I did ask, could you hold him up and let me see how he stands when you hold him? But just going through that. And again, that's awfully similar to what we do when we're face to face.
Yeah, I think the sort of having the confidence and knowing it's okay to be a little directive within, you know, the support you're providing, but it's not, I need you to do this. Like you said, Maria, do you mind taking his shoes off, or could I see how you stand him up? I think it would be really important too to make sure the families understand why you're asking to see that. You know, so could I see that because that's your concern, or can I see how he stands up because it helps me look at how his I don't know, I'm making this up, you guys could do this better than me, but you know, how whether he's on his flat feet or whatever, to explain, helping the families understand that. It's going to help empower them to be an active part of the process. Well, you know, Jen, I'm going to throw it at you. Let's get all of our PTs. Any other thoughts about how you're getting the information you need? Do you have your Raggedy Ann doll handy?
I do. He's sitting right next to me. But one of the things that our kind of PT staff was a little bit concerned about going into this was how we were going to do assessments for babies with torticollis, since we weren't sure kind of how are we going to be coaching them through kind of some of that positioning without being hands-on and making sure that we weren't kind of guiding them into do something that was less safe. And so we found that using our dolls has been really helpful in kind of like positioning them like facing the camera, so you can be seeing kind of exactly how far the babies are able to turn their head, and really kind of coaching families through, you know, where to place things, to look at tracking and other activities, or kind of changing the view of the camera. A lot of families, you know, like might want to look at us, but we are like, well, can you actually like flip your camera view around so we can see what your child is doing, and then we can follow them around? Or it's easier for like one parent to get really close to show us, you know, what it looks like if they're eating, or what it looks like when they're, you know, moving their legs, so that we're able to get kind of some more clear information.
Yeah, I think it's almost like you're probably having to be more intentional about how you explain things to get what you need too. I had another colleague of mine said that she was on an assessment and both parents had called in on their phones to the Zoom meeting separately, which ended up being kind of cool because they could almost see the child from two perspectives when they needed to. So I thought that was kind of a neat idea too. So great suggestions. What about you, Lauren, from a speech pathologist's point of view? Are there any suggestions you have for being able to get what you need? Especially, I'm curious about even the oral motor piece of it too.
Yeah, so actually we did an assessment yesterday for a 2-month-old little girl with Down syndrome. And she had a pretty significant feeding history, and I had a bottle ready to go to talk about nipple shape and flow rate and latch. And was able to use the nipple on here as a fake pacifier as I was trying to coach the family through some strategies to support her sucking skills. So that little prop was helpful. I think in terms of oral motor, like if we're talking about a child with a feeding concern, we're doing as much observation as possible and kind of asking the family, if possible, to set up their screen just like this, right opposite the child, so that we can get as good a picture as possible of their chewing skills. We're obviously not going to be able to see things quite as well. Similar to, I think, what Maria said about sort of telling the family what the base skill that we're looking for is, when it comes to like coaching the family through something like book reading or manipulative play, like on the ELAC, the block stacking items that, play such a role in fine motor and cognition. I've found more success with telling the family like what we're looking for there. So, it's not just about can she stack 5 blocks, but it's, we want to see how your baby uses her hands and her eyes together. What kinds of things have you seen her put together? What toys, does she like to play with? Can you pull those out and show us how she plays with them? What happens if you try to put one in her other hand and really coach her through it, knowing that, for example, it might not be small square blocks that they're stacking, but we saw a child last week who was super interested in stacking these long, skinny, cylindrical wooden blocks and could stack several of them up into a tower, which was, I thought, like a very good demonstration of that cognitive concept and the fine motor skill, even though it wasn't exactly in the sort of the test item that we were looking for. By telling the family what we were looking for, overall, they were able to identify the play items that their child was familiar with that would help us to see their best skills.
I love that. Love it, because it's kind of making a connection for the family too on what the child is doing that's, and why that's important. And I think what comes to me, Lauren, when you were talking is really that idea of understanding what's behind the test items and all the sort of the abilities that the test items demonstrate to us versus the test item itself being the super important thing. Now in Virginia, we don't have to use a standardized tool, so we have some more flexibility. There are some states that are still struggling with using some standardized tools, but I think what you described is just like good assessment practices, that flexibility and being able to have really strong observation skills to know what you're looking for and the different ways you can see it. So Sandi, I'm going to wrap this one up with you. I'm curious, I was thinking about you as an educator, me as an educator too. I've heard people have some stress about, like, what if they don't have the 3-piece puzzle? Or, you know, some of those, I know Sandi's shaking her head. I totally feel you. So I'm curious about what your educators have talked about, or what strategies you might be using to try to, like, Lauren kind of opened it up for us to get at some of those concepts.
Lauren did a beautiful job with this, and that is absolutely understanding what are you looking for and why. It's not about, can you get pegs out of a bottle? That is not the skill we're looking for. We're looking for problem solving. We're looking at wrist rotation. That's what we're looking for. So being able to understand that and coach the family through that is really what that critical piece is. I think we can all just say, I don't think we have to get a stick out and endanger the family with a stick to try to get to a toy underneath the couch. That's not what we really need. So so that's where we are. We're using the toys that they have. So you talked about a 3-piece puzzle. I have been amazed, and I've done about 10 assessments now so far. I'm amazed at how many families have shape sorters, which can be a nice little stand-in for it. Is it the exact same thing? No, it's not. But it can be a nice stand-in. And there's other families that have other puzzles, you know, the wooden puzzles that have separate spots. And we just use those and we flip them around a different way and we make do. We're really looking for how the child's problem solving and being able to control their eyes and their hands working together. So we just make it work. I will add on to this. We spend a lot of time at the very beginning doing the routines questions. And so there's about 30 minutes of talking with the family, and the child's in the background. So we get to watch the child play without there being any pressure. And there's so much information that comes out of that, particularly the social piece and the language piece, because there's no pressure to do it. And then even afterwards, when we go to the play-based portion, there's a fair amount of free play. And I'm just amazed at how much more we see with the kids. And I'm kind of wondering, without having 3 strangers right on top of the child, how much more are we seeing them perform? You know, is this a truer assessment, even though maybe it's not as clean with the protocol, but is it a truer testament to what the child does?
I think that's such an interesting point. Won't it be interesting to see after we get through the pandemic, and which we will, we get through the changes. You know, I think Ginny, you were on a meeting, I was on a meeting with you, and you said something like, we can't put this toothpaste back in the tube. You know, we have kind of opened the door on some practices that could end up being better in the long run. Some pretty powerful stuff, because I do believe that, Sandi, that is, no matter how friendly we are, how kid friendly we are, we change the interaction just by our presence. So looking through the lens of a camera, maybe you do see some stuff you might have not seen before, or it might have taken you longer to see as you got to know that child, you know, down the road, if you were the provider. So these are great suggestions. This is exactly what I wanted to kind of get at. I'm curious then, I guess we'll kind of wrap up with, if there are any other tips you might have for people that are feeling a little uncomfortable about this or a little worried about it. I think a lot of people in Virginia who were doing assessments before have started conducting them. I know there's some programs that maybe just started last week. I know some of you guys have done lots of assessments by now. So I'm just going to ask if you guys have, you know, if you could give some advice to somebody who's just new to this, like I guess everybody is, but who's feeling a little worried about it. What might your advice be? I don't know. Jen, do you mind going first?
Sure. One of the things that I would say is that something that we've been talking with all of kind of our families and our therapists is that kind of we know that this is a weird time and that we want to give everybody grace in kind of being flexible, realizing that these are not kind of the standardized assessments that we maybe were doing before, but that kind of our goal is not to be able to tell you exact age levels of your child. Kind of the goal of early intervention is to be working with those routines and kind of making those family changes to help children participate. And that I feel like we really can do that regardless of kind of how specific items on tests perform, that kind of we're really being able to see more of that functional assessment. And so kind of we've been really kind of encouraging everybody that we're talking to in our system that kind of doing your best and kind of meeting families where they are, meeting all the different providers who are doing assessments where they are, and just being able to do kind of the best that you can do in that situation. And and kind of making the best of that, and knowing that kind of we've gotten a family in the door who maybe wasn't going to be getting services, but now is able to start that process.
Definitely. And I love what you said. And if, you know, I know that our state guidance, you can see my dog in the background, there she is. Our state guidance has suggested you can always write that on the IFSP, write it in the note that this was the best you could see. This is how you gathered the information. And I think, like you guys said, sometimes what we're feeling like we're just doing our best, we're still getting really good information. Sandi, do you mind adding? Do you have any advice maybe you're giving your staff or other people about jumping into the process?
So I think for us, the most important thing was to practice on all of the platforms that you're using. So if you have one consistent one, great. But if you have more than one, make sure you practice and practice with multiple people so that you can practice adding people into it. And then we also practice what happens when somebody drops out. How do you get them back in? Because that is the one of the consistent things. There always is one little hiccup in technology. Somebody will drop out for a couple minutes and you have to pull them back in. With the technology, you know, they've dropped off of that, and so you need to add them back in. So that's kind of a given. It goes smoothly, and it takes, you know, 10 seconds to bring them back online. But just knowing that's going to happen, so you can be prepared for it and not frazzled when it does.
Yeah, sort of accepting that might be an inevitability, but we can get past it. Yep. Well, you brought up practice, Sandi, so I'm going to throw this to Lauren, because I know, Lauren, you had mentioned to me that you guys as a team did some practicing before you started doing assessments with real families.
Yeah, so in Fairfax, we are fortunate to have several ITC staff members who have children in the birth to 3 age range, and we used our own children as like guinea pigs and practiced so that many members of our assessment staff were able to participate in a practice assessment before they participated in an actual assessment. So that was really helpful. Personally, I acted both as an assessor during one of the practice assessments and as a parent with my own toddler. I think that experience acting as the parent was probably even richer, because I understood at the end of 2.5 hours like what the parents are going through, and it just enabled me to be a little more sympathetic, possibly slow down myself, as I am also a person who tends to talk quickly and ask a lot of questions, and you know, get a sense for what it's like for our families who are going through this at this time. But I mean, I do agree that practice is key. And I wanted to mention one other thing, Dana, just reflecting on your question. I've been trying to look at this, at least for myself, as an opportunity to use more coaching in my assessment, as opposed to just using coaching during my therapy sessions, because I think it can be a little bit disconcerting for some of our families who come into our program not really knowing what early intervention is, and understanding what sort of our approach to treatment, and go through sort of a very like, okay, the PT is going to move my baby and show me how to position, and the speech therapist is going to show me how to hold her, so so I can do the pacifier, and then someone comes out to their house and it's like, no, you're going to do it. I'm going to teach you how to do it. I think that sometimes feels a little uncomfortable for some of our families. So families who are coming into us at this time are going to have that approach from day one, from their assessment to their initial telepractice sessions to hopefully when we get to meet with them in their homes. And so I'm hoping that helps with flow and carryover and sort of parent investment in the early intervention approach.
Yeah, it's a different system than before. And I think from what I'm hearing folks say, that, it's sort of supporting that parent participation in a different way than before, because you're not physically there to do the rolling the baby over or holding the pacifier. And so your coaching, a friend of mine said, your coaching muscles are getting stretched. So you're kind of stretching your coaching muscles, and the parent is from the get-go kind of holding more of that responsibility when he or she may have not even expected that was what was going to happen before. So that good collaboration, it'll be real interesting, Lauren, to see what happens with this group of families when you do get back to the face-to-face, and to see, I bet that's going to be even cooler collaboration at that point. Ginny, did you have any thoughts about any other ideas or advice for folks who are just getting into this?
I agree with what the lady said. Be flexible, prepare ahead of time. So do that dry run. It will just relieve a lot of stress from you, because just practice makes perfect. So, and we are learning as we go. And I think that's important to tell the families. This is new for us. It's new for them. So the grace that was mentioned for the first answer, I couldn't agree more. We need to all give each other permission to learn this together, because we're kind of building this plane as we fly it, really. So, and also to plan, what are you going to do? Hope for the best, but prepare for the worst. What will you do? Like Sandi said, if that call is dropped, who's going to call back? And sometimes I haven't experienced it, nor has my staff that I'm aware of, but I think you also have to prepare for, what if you just have to stop? What if it's just not working? So I think you should go into it with knowing that that is a possibility. And then you need to plan really quickly for, how are we going to pick this back up? What are we going to do to get through this? Because we still have our timelines to think about. So just all those things, reiterate what the lady said, and we'll do our best. And I'm hearing great things from my own program and local programs up here too.
Good. That's what I've heard, folks feeling anxiety going into it, but once they settle in, like, okay, this can kind of work. We can make this work. But you're right. You guys are all suggesting planning and preparation, and then some flexibility. And I think, a little sense of humor probably when somebody drops out, we're going to find them. We're going to find them in cyberspace. We're going to bring them back. Let me ask you, Maria, any other final thoughts about some advice or anything?
I think, reading the family's cues and giving them permission to end it, because I had a child that, it was nap time and she was the only one there, and, she looked really stressed, and we said, I think we have enough, and what I don't have, I'll email you and I'll get that information, because our IFSPs are set up later. So and she was relieved, and I think when the assessments go well, they are eager to jump into services, because I think they're getting something out of just that assessment piece, that they're ready and eager to start. And so I've seen a turnaround of families having everything together for their IFSP, because they want to know when they can start.
Yeah, so sort of you want it to be a good experience at the beginning, so we're ready to keep on with the rest of the process. Absolutely. Well, thank you guys so much for all that you've shared and your great ideas. I hope this will be helpful to other people, just to hear from folks who are in the field working through this. Like, I think, was it Ginny, you said we're building the plane while we're flying it. So, just give yourself some practice and patience for yourself and your families. I do think people are doing their best, and from what I'm hearing, early intervention is still going on. It's going pretty successfully, even if it looks different. And it's kind of, I think we're in this evolution phase that we're going to be in a different place eventually. And I hope it's going to be even a better place after you sort of shake off the experience that we've all been through. So thank you guys for sharing your experience and your expertise. I really think it was valuable. I really appreciate it.